So next we call Dr. Prasanjit Kalita. Dr. Prasanjit, no,
Yes.
presently Qatar is Dr. Rima, sorry.
Rima ka chal raha hai.
कौन सा है थर्ड अच्छा अच्छा
Now we are going according to our
ओके ओके Why did you take the first two out of because they are
they have other commitment they have to go.
Please start.
Good afternoon, everyone. Today I am going to speak on a study on digital eye strain among patients attending a tertiary care hospital. As we know, globally, newer advancement and technological innovations has changed the world into new and various dimensions. Since the invention of computer, information are passed digitally from communication to living assets to healthcare to education system. Like industrial revolution, digital revolution has put the entire globe in one screen, but still it has its own advantages and disadvantages. As outlined by the American Optometric Society, digital eye strain encompasses a cluster of ocular and vision-related problems attributed to prolonged uses of desktops, laptops, mobile phones, tablets, e-readers, and storage devices. My aims and objectives were to assess the prevalence of digital eye strain, to assess the various risk factors of digital eye device usage pattern, and to correlate them statistically with clinical features. This is a hospital-based prospective study which is conducted in Assam during October 2022 to 23. 2030 participants were screened for digital eye strain-related symptoms and history of digital device uses. My inclusion criteria are all patients who attended the OPD from 11 years to 70 years, high myopia, any eye inflammation, cataract, variety of glaucoma, eye surgery, any retinal pathology were my exclusion criteria. So, in the results, 43.5% belong to the age group 11 to 30 years, followed by 34% between 31 to 40 years. Female were 60% and males were 40%. 62.5% patients had education level of graduation or above. 52% had no optical aid. 38.5% had used spectacles. We have assessed the risk factors such as average time spent for digital device uses per day, approximate screen distance, contrasticity like light and dark, and ideal way of digital device uses. This is the distribution of various symptoms of digital eye strain in the study participants. The more common symptoms we found were headache 70%, watering 60%, and dry eye 50%. The role of gender was found to be statistically significant in all the symptoms except watering, and the role of age was also found statistically significant in case of dry eye, foreign body sensation, watering, headache, and eye rubbing. This is a table showing association between risk factors and clinical symptoms. 30% used digital device for less than 4 hours, 60% used it for 4 to 6 hours, and 15% used it for more than 6 hours. And 70% used approximate distance of screen less than 50 centimeter, while 30% used more than 50 centimeter screen distance. 41.5% patients took break after 30 minutes of continuous uses of digital device, while 58.5% didn't take any break. So in the results, dry eye, watering, headache, temporary difficulty in gaze, and blurring of double vision were statistically significant with average time spent for digital device uses. Dry eye, foreign body sensation, headache, temporary difficulty in gaze, double vision were found to be statistically significant in contrast to approximate distance of digital device uses from eyes. In context to taking preferred break after 30 minutes of continuous uses of digital device, all were statistically significant except eye rubbing and double vision. We took more than 11 years of patients, as in today's era, all age group people are using digital devices. The 43.5% belong to 11 to 30 years of age group, 34% belong to 31 to 40 years of age group, and 22.5% belong to 40 years of age group. Similar studies were done by Thomas S. et al., where they found that 55.4% were males and 44.6% were females. Khan et al. And Santa Kumari also studied similar paper in which they mentioned headache as the most common symptom. So in conclusion, I want to say that headache, watering, and dry eye are the more common symptoms seen in case of digital eye strain, and all these were statistically significantly associated with average time spent for digital device uses, approximate distance of digital device from eyes, and taking preferred break after 30 minutes of continuous uses of digital device. There's no source of funding, no conflict of interest. These are my references. Thank you so much.
Thank you. Any questions?
Just one question before you go. Yeah. The result, uh, the incidents are more higher in younger age.
Yes, yes, sir.
But one of the symptoms, dry eye, watering, these are more common, usually not actually told by the younger generation, but more for the older generation.
yes.
But you said over 40, they have less symptoms. Okay. First thing, don't you think that over 40 they don't use mobiles or laptops nowadays?
Yes,
Over
yes.
40, lots of people nowadays do more, and they get more dry eye symptoms because the ages the dry eye
Yes,
make
ma'am.
more obvious, or they get more symptoms. So why there is a skew, or why there is a the results are why different?
Maybe because nowadays in younger generation they also use lots of technological devices.
Has any single patient has told you at the age group of 15 or 20 they're doing all the time in mobile, has they actually ever mentioned that I suffer from dry, I suffer from sort of pain, ache, headache? Has they mentioned? I don't think. It's probably interpreted, or you just sort of gave leading questions. Otherwise they never say. They, because they know their parents are there, and if you say that it's the symptoms due to that, they won't be allowed. So I don't think they ever say that oh, you have got any symptoms. Either they don't have or they don't bother.
Yes, sir.
So I think it is not, probably the result is not reflecting the true story.
Yes, sir.
Okay, thank you.
Thank you.
Thank
Thank you.